Welcome to Pindar Poetry. We hope you learned something new.
You begin immediately by confirming gestational age and prior reports, because timing changes accuracy. Next, position the patient supine and decide if a full bladder or gentle tilt improves visualization. Use a high-frequency probe and quickly optimize depth, gain, and focus so the fetal pelvis and genital region are within the image window. Once done, sweep slowly in transverse and sagittal planes, pausing where anatomy is clearest. Document fetal position and capture stills and syn loops for comparison. You now focus on detailed anatomy. Locate the genital tubercle, scrotal sac, or labial folds in both transverse and sagittal planes because views alter interpretation. Apply gentle colored Doppler to distinguish bladder and cord vessels from vascular genital structures and adjust angle to reduce artifact. Then, compare what you see to expected morphological markers for male versus female at the specific gestational age. If ambiguous, obtain alternate views and measurements, capturing labeled stills and syn clips for the report and for peer review. You finish by writing a clear statement. Specify male versus female and rate your confidence as definite, probable, or indeterminate, and include representative images. Explain any limitations, such as fetal position, low fluid, maternal body habitus, or timing outside the optimal window, so the reader understands uncertainty. If images are inconclusive, recommend a repeat ultrasound at an appropriate interval or alternative assessment. And give one troubleshooting tip. If poor visualization, reposition mother and request feedback.
Thanks for watching. Consider subscribing if we helped you.